Hi, my name is Connie Koklanis and you're watching the video Measurement of Strabismus, Simultaneous Prism Cover Test. Now, in the previous video we discussed the Prism Cover Test and we talked about the fact that that particular test utilises the alternate cover test as part of that assessment, and that the alternate cover test is unable to distinguish between a manifest and a latent deviation. Now, this isn't generally an issue because you will have performed the cover test before proceeding to the PCT, and the cover test will give you the information of what the strabismus actually is. So if you have, for instance, a left exotropia, the PCT, whilst it can't tell you whether it's an exotropia or an exophoria, the size of the deviation will correlate to that LXT, or that left exotropia. However, what happens if you have both a manifest and a latent deviation present? This happens in a small group of patients who are known to have what's called a microtropia, and we'll talk more about that later. But for a patient who has a small angle manifest strabismus and an underlying latent, the Prism cover test, which uses that alternate cover test, will measure everything, both the manifest and the latent. So the question is, how do we go about finding out what the manifest or what the size of the deviation is for just the manifest component? And this is what the simultaneous prism cover test is. And let's go back to the cover test, to those three components, the cover, uncover, and the alternate. Which of those three components detects only the manifest component? The cover component. So this is now what we're going to use to find out the size of the manifest component of the deviation. You'll see here now that we'll put the prism once again in front of the deviating eye, and the occluder will go in front of the fixing eye, but this time we're not going to alternate the cover. What we will do is we will bring the cover on at the same time as the prism. And so as we see here, the prisms come on at the same time as the cover, and in this particular instance it's indicating that we have an undercorrection, because as the cover has come on and the prism has come on, what you'll watch for is movement under the prism. And what we have here is the eye moving out. This was originally an ET, a right ET, so it has to come out to take up fixation. And this prism of 5 diopters is an undercorrection. So the next step is to grab a 10 diopter, bring them on at the same time, and what we see now is that when the prism goes on at the same time as the cover, the eye under the prism has not moved to take up fixation. Why? Again, same reason for the PCT. The light rays have deviated towards the fovea, and therefore there's no need to make a movement to take up fixation. So in essence, what we're doing is we're covering and uncovering the fixing eye, and when we go to cover, we're also introducing the prism in front of the deviating eye. And what we're interested in is only looking at the movement under the prism when the cover goes on the fixing eye. Okay? And when you see no movement of the eye under the prism, you found the size of the deviation. And just as with PCT, you can move into overcorrection and reverse the movement, and in this instance we move into having an exo movement, so we'd see the eye going from out to in if we overcorrected. So the simultaneous prism cover test will give you the manifest component. If you want to work out what the latent component is, you then need to proceed to do the PCT, which will give you both the manifest and the latent component, and then subtract the PCT from the SPCT. In terms of recording, we would write SPCT for simultaneous prism cover test, and it will be known now that this is the manifest component of the deviation. and indicate the prism that neutralised the deviation. So 10 diopters base out or plus 10, which also indicates that it was an ESO deviation. Okay, that brings us to the conclusion of this video. Thank you for watching.